Hi students, in this video we are going to look at anatomical landmarks and maxillary anatomical landmarks. And then towards the end of the video I'm going to show you a few questions which were asked previously from this topic and how you should be approaching those kind of questions. Now, giving you a quick brief on understanding anatomical landmarks and their importance in complete denture fabrication, I always try to use this as an example that making a denture is similar to making a dress. So if you are trying to make a shirt and a pant, that's like a maxillary denture and a mandibular denture. Both of them require different kind of measurements. Both of them require different kind of details to be captured, and you need to understand the different segments of making it for correct fit. So the idea of making a complete denture is that it should fit correctly and it should preserve the structures that are underneath. Okay, the preservation of these structures is more important than restoration according to Devan's dictum. So whenever we are planning a prosthesis, we need to be aware of the anatomy that lies underneath, because we always start with anatomy, right? Even in your curriculum, you start with anatomy and then you build over it one by one. Now, understanding the anatomy helps you enable a proper force distribution of occlusal forces, and you can also make sure that you are not interfering with normal form and function. What does that mean? That means that there are some landmarks that are very good for taking up stresses. So we have stress bearing areas, some landmarks which will not take up any stress. In fact, if you put any pressure on them, they will have a rebound effect. That means they might either get traumatized or they might have some kind of discomfort associated. So they are called relief areas. And lastly, areas that help you decide the border, which are limiting areas. Okay. Now, on a broader perspective, what is a stress bearing area? As the name suggests, areas that can bear stress. So, these areas must be very good in terms of their quality. So, the bone and soft tissue, both of them should be ideal. Now, good quality bone means compact, dense bone, or something that does not resorb very easily. And soft tissue would mean good keratinized, thick tissue which doesn't easily get ulcerated. Only then it can take up the denture load very easily. Now, stress bearing areas are further classified as primary stress bearing areas or secondary stress bearing areas or supporting areas. Okay, so primary is the main stress bearing, secondary is also called supporting areas. Now, these terms will remain common for maxillary and mandibular arches, but the classification or the areas will differ for each of them. The second area is the relief area. Now, relief, as the term suggests, you do not want to put any pressure, no pressure areas. So, if this is the tissue surface and if this is your denture on top of it, there should be good contact between the tissue and denture, tissue surface and the denture bearing area. But if it is a relief area, you should leave a little gap in between both of them. This is known as relief. Okay, so this is called relief or no pressure on that area. Now, some areas, if you put more pressure, they might either become ulcerated or any form of trauma may happen to them, or they may lead to pain, pressure, or lack of sensation, paresthesia. Now, the pain could also be mild pain or tenderness. So, if you touch, it feels like there is some amount of pain. So, any of this is possible if you put pressure on relief areas. Now, why are relief areas so picky? Because they have nerves and vessels underneath, or they may have any soft tissue epithelium on top of it, or they may be interfering with denture placement. It could be a variety of reasons. So this is the background on relief areas. Then comes limiting areas. Now, limiting word is very clear. It means boundary. Limit means boundary or border. So whenever you are determining the limit of the denture, it will make sure that the fit remains adequate. Now consider the same dress example. If the dress is too big, it is going to interfere with walking and movements and everything. So the action resultant due to overextension is dislodgement. So if something is overextended, if the denture is overextended in an area, from that area the denture will lift and cause dislodgement. If it is underextended, it will cause lack of retention and support. Clear? So this is the fundamental understanding of different anatomical landmarks. Now, before we go to the workbook and solve the blanks, let's try to understand the same thing with this example. Now, this is a maxillary edentulous cast, and limiting areas, let's start with limiting, are always towards the periphery. Okay, so you will have limiting areas at the border, correct? So, this is all limiting areas. That means if you extend your denture beyond this, something will be compromised. The fit, retention, overextension, underextension, depending on that. Now, it is important for you to know landmarks clearly because your post-insertion problems, which is very commonly asked in the exam, depends on this. So, you must correlate a post-insertion problem to the related anatomical landmark if it's possible, and then you can come to a conclusive answer. Then relief areas are usually smaller. So here you have the incisive papilla, you have the mid-palatine raphe, and they are very well demarcated. Then rugae are either secondary stress bearing or relief areas. So if they are very prominent, then they are relief areas. We will talk about it further. And then primary stress bearing areas are very specific areas that provide a good amount of stress concentration to the underlying tissues. So in this case, the posterior lateral slopes of hard palate is the primary stress bearing area. And then you also have the crest of residual alveolar ridge. We will talk about it in detail while solving the workbook. Now, let's solve whatever we've just spoken. Stress bearing areas are nothing but load bearing areas. And the denture should be designed so that most of the load is concentrated on these areas. And the word support is important when you talk of stress bearing areas because it is the resistance to displacement towards the basal tissue. That means whenever, suppose this is your denture, and this is your tissue. Now there are two words, actually three words that you need to know. One is retention, stability, and support. So retention means dislodgement of the denture away from the forces of mastication. So the denture sits like this on the tissue, and the opposing force is how much the retention is present. So if I pull a maxillary denture down, that is against the path of placement, it will tell me how retentive the denture is. Stability, on the other hand, is a lateral. So if a denture is rocking on the tissues, it is stability. And support is the tissue-ward movement. So maximum coverage is related to support. So if a denture is pressing well towards the tissue, that means it is well supported. Okay, so these three terminologies you will take some time to get familiar with them, but as you watch more of these videos, I will be using them more frequently. So support is nothing but the resistance to displacement towards the basal tissue. Right? So that is important when you talk about stress bearing area. Then we have relief areas. Now, a relief should be provided during denture construction on specific areas, otherwise, these areas might resorb under constant load, or because they may have a fragile epithelium, they might get ulcerated. Okay, so thin mucosa is one specific criteria for relief areas that you need to keep an eye on because they may easily get traumatized. Then the limiting areas are the extensions of a denture base. So you need to provide optimal extension of the denture so as to engage maximum surface area without engaging upon the muscle action. So you should not hamper any muscular movement. That is why we do border molding. So the idea behind using this as an example is because we always start with a rough measurement and then we can refine, right? So we do a primary impression, just like how the tailor takes a rough estimate. Then if you tell them that I need this to be altered, this fitting is not correct. So that is all done at border molding, which is more refined for each measurement, and then you fabricate the denture. Likewise, you fabricate the dress or make a dress. So limiting areas are the areas where if you encroach, then it will lead to dislodgement of the denture, and it will also lead to soreness because the denture is pressing on the areas where it should not be pressing, leading to ulcerations and soreness. Soreness is when something is, if it is touched, it becomes painful. Now, if you cover these areas, then the structure will lead to reduced retention, stability, and support. So, there will be a decrease in retention, stability, and support of the denture if you have overextended or underextended denture borders. So, now let's take a look at the schematic representation of different anatomical landmarks of the maxilla that we've just discussed. We can use the color code blue for stress bearing, red for relief, and purple for limiting. Okay, so the stress bearing areas commonly that you need to know are primary and secondary. The primary stress bearing area is the posterolateral slopes of hard palate. Now, this is anterior, this is posterior, this is lateral, and this is lateral. So, this is the hard palate. Slopes of hard palate are this. Posterolateral slopes of hard palate is the most important primary stress bearing area. And the second stress bearing area in the maxilla is the crest of residual alveolar ridge. Now, this is the crest, this is the slope. Okay, right? This is the alveolar ridge, all of it. Alveolar ridge is the place where earlier there were teeth, there were sockets. After extraction, they remodeled and formed this convex contour. So, this is the slope. This is the crest. Crest is the highest part, slope are the two angular portions coming to form the crest. So the crest of residual alveolar ridge and the posterior lateral slopes of hard palate are the two primary stress bearing areas, and the secondary stress bearing areas are the rugae. So the soft tissue folds here in the front anterior part of the palate, and the maxillary tuberosity. These are secondary stress bearing areas or support areas. Then we have relief areas. So the first is incisive papilla, mid palatine raphe, that comes over here. Then you have torus palatinus, which is a bony exostosis present on the palate in some cases. Then you have sharp spiny spicules, which are present after extraction, which do not resorb. So if they are very sharp, they are covered by thin epithelium, and when you put the denture on top of it, they get compressed and pain. Then you have cuspid eminence. So if you look at this area where earlier the canines were present, you will see a little bulk of bone in this area. This is called cuspid eminence. Now, why is cuspid eminence a relief area? Because if it is too prominent, then the denture seating and removal might become a problem, and this can act as an interference. And that removal and placement may cause tenderness and pain in this area. And lastly, you have the zygomatic process of maxilla. So, this area of the maxilla where the zygoma attaches to it, if it is too bulky and prominent, it will cause the denture to dislodge and it will not allow proper seating of the denture. So, that is the zygomatic process of maxilla. And lastly, limiting areas. So, limiting areas are by default always present around the periphery. So, you have the sulci and the freni vibrating lines, which are the limiting areas. So, all this is the limiting area of the maxillary foundation. Now, let's fill the table. So, the classification of maxillary anatomical landmarks. Stress bearing primary are posterior lateral slopes of palate, hard palate, and you have crest of residual alveolar ridge. Secondary areas are rugae and maxillary tuberosity. Relief areas, incisive papilla, mid-palatine raphe, torus palatinus, cuspid eminence, sharp spiny spicules, and zygomatic process. And the limiting areas are labial frenum and labial vestibule or the sulcus, buccal frenum, buccal vestibule, hamular notch, posterior vibrating line, and fovea palatini. Now we will discuss all of them in detail. This is just an overview for you to get oriented to the different structures.